Now let's see the medial boundary of this rectus sheath. The medial boundary of this rectus sheath, it is going to be formed by this linea alba. So here in this figure we can appreciate that this is the interlacement of the three flat muscles aponeurosis in the midline, and this is the fibrous structure called as the linea alba. This linea alba, it is going to attach above with this xiphoid process and below with the pubic symphysis, and it is narrower in the lower part while it is broader in the upper part. In the lower part, this linea alba, it has two expansions, and one expansion passes superficial to the pubic symphysis, and this expansion, it is going to attach with the dorsal surface of the penis and going to form the suspensory ligament of the penis. And the deep fibers of this linea alba, they passes posterior to the rectus abdominis muscle, and they are going to attach with the pubic crest, and these deeper fibers of the linea alba, they are called as abdominiculum linea alba. Sometime at the time of the pregnancy or at the time of the excessive stretching of the anterior abdominal wall, this weakness of this linea alba is there, and it will lead to the broadening of the linea alba, and in this condition the rectus abdominis muscle of the both the side, they are going to deviate from each other, and this condition, it is called as the divarication of the rectus. And this divarication of the recti, it is not the herniation, but it is the weakness of the linea alba. Now when we see the lateral margin of this rectus sheath, it is going to be formed by the linea semilunaris, and this linea semilunaris, it is attached lower side with the pubic tubercle, and upper side it is going to attach with the tip of the ninth costal cartilage. This linea semilunaris, it is the very important landmark because lower 6 thoracic spinal nerves, they are going to enter within the rectus sheath through the line of this linea semilunaris, and that's why the surgical incision of the anterior abdominal wall along the linea semilunaris would be unwise because it may produce segmental paralysis of the rectus abdominis muscle due to the injury of the lower thoracic nerves. So this is all about the boundaries of the rectus sheath. Now we are going to see the contents of the rectus sheath. When we see the contents of the rectus sheath, there are three types of the major contents are there. These are the muscles, vessels, and nerves. In case of muscles, we have already discussed two muscles. These are the rectus abdominis muscle and pyramidalis muscle. Vessels present within this rectus sheath, these are the superior and the inferior epigastric vessels. The nerves present within this rectus sheath, these are the lower 5 thoracic nerves and the subcostal nerve. So we can say it contains the T7 to T12 spinal nerves. So out of these three major contents, the muscles we have already discussed in my previous lectures. I am going to put the link in the description for the muscles. Now let's see the vessels, which are the content of the rectus sheath. And for that, let's see one image. Within the rectus sheath, the two vessels are there, and these are the superior epigastric vessels and the inferior epigastric vessels. The superior epigastric vessels, they are present to the upper part of the rectus sheath, and it is the branch of the internal thoracic artery, and the superior epigastric vessels, they enter within the rectus sheath at the gap between the xiphoid process and the 7th costal cartilage. And this vessel is going to run between the posterior surface of the rectus abdominis muscle and posterior wall of the rectus sheath. So it lies between these two structures. And that's why we have shown this vessel in a dotted fashion. And the superior epigastric vessels, they are going to anastomose with the inferior epigastric vessels near the umbilicus, and which is responsible for the collateral circulation between the upper limb and the lower limb. Now let's see the inferior epigastric vessels. The inferior epigastric artery, which is going to arise from the external iliac artery, and this external iliac artery, it is going to continue as the femoral artery below the inguinal ligament. So just above the inguinal ligament, the inferior epigastric artery is going to be arise from the external carotid artery, and it runs behind the fascia transversalis. And this inferior epigastric artery, it lies just medial to the deep inguinal ring, which is the opening within the fascia transversalis. At the medial margin of the deep inguinal ring, where this inferior epigastric artery is going to pass, it is going to hooked laterally by the vas deferens in case of male and the round ligament of the uterus in case of female. Because this structure, it is going to pass through the deep inguinal ring and going to run within the inguinal canal. This inferior epigastric artery at the lateral border of the rectus abdominis muscle is going to pierce the fascia transversalis, and then it enters within the rectus sheath, and it lies between the rectus sheath and the posterior surface of the rectus abdominis muscle, and ultimately going to anastomose with the superior epigastric artery at the level of the umbilicus. This inferior epigastric artery having so many branches, and one of them is the cremasteric artery, and this cremasteric artery, it is going to enter within the deep inguinal ring to supply the spermatic cord. One more important artery from this inferior epigastric artery, that is the pubic branch, and this pubic branch is passes downward and medially along the medial margin of the femoral ring like this, and it lies on the lacunar ligament, which is present somewhere here. And this artery and this pubic branch of the inferior epigastric artery, it is going to anastomose with the pubic branch of the obturator artery. Sometimes this pubic branch of the obturator artery is absent in 28% of the individual, and at that time this enlargement of the pubic branch of the inferior epigastric artery occur, and which replaces the pubic branch of the obturator artery, and at that time it is called as the abnormal obturator artery. And this abnormal obturatory artery can be injured during the femoral herniation operation while opening of the femoral ring by cutting the lacunar ligament. And at that time, the excessive bleeding may occur. So this should be kept in mind. Now, other than this cremasteric branch and the pubic branch of the inferior epigastric artery, few other branches are there, and these are the peritoneal branches, muscular branches, which are going to supply rectus abdominis as well as the pyramidalis muscle, some anastomosic branches which are going to anastomose with the superior epigastric artery, and some are the cutaneous branches which are going to pierce the muscles and going to reach anteriorly to supply the skin of the anterior abdominal wall. When we see this inferior epigastric artery, we can mark that one triangle is formed, and this triangle, it is formed by laterally by this inferior epigastric artery, medially by the medial border of the rectus abdominis muscle, and inferiorly by the inguinal ligament. And this triangle, it is called as the Hasselbalch's triangle. And this Hasselbalch triangle, it is very important in the diagnosis of the inguinal hernia, which we are going to see in detail later on. So this is all about the vessels present within the rectus sheath. Now let's see the nerves which are present within the rectus sheath. The lower 5 thoracic nerves and the 12th thoracic nerve, that is the subcostal nerve, they are the content of the rectus sheath. So we can say that T7 to T12 spinal nerves, they are present within the rectus sheath. Now let's see the course of these nerves, how they approach the rectus sheath. Here, this is the transverse section of the abdomen, and for the better understanding, we use blue color for the nerves. So here, this is the anterior root and the posterior root. They are going to fuse to form the spinal nerve, and this spinal nerve gives one dorsal rami, which passes posterior side and going to supply the skin and the muscles of the back. And the ventral rami, it runs and passes between the transversus abdominis and the internal oblique muscle and passes forward and reach up to the deep lamina of the internal oblique muscle, which it is going to pierce and then supply the rectus abdominis muscle. And after supplying the rectus abdominis muscle, it gives the cutaneous branch, which is going to supply the anterior abdominal wall skin. And at the middle of its course, it is going to pierce the internal oblique and the external oblique muscle and gives one lateral branch. And this lateral cutaneous branch, it provides the cutaneous branches to the anterior abdominal wall. So we can say that these nerves, they are present between the internal oblique and transversus abdominis muscle, and that's why this plane, it is called as the neurovascular plane. So the neurovascular plane of the abdominal wall, it passes between the internal oblique muscle and transversus abdominis muscle. For the segmental innervation of the anterior abdominal wall, let's see one more image. Area around the umbilicus, it is going to be supplied by T10 spinal nerve, and the area above the umbilicus up to the xiphoid process, they are consecutively supplied by T9, T8 and the T7 spinal nerves, while the area below the umbilicus up to the symphysis pubis, they are going to be supplied by T11 subcostal spinal nerve and the L1 spinal nerve. So the anterior abdominal wall, it is going to be supplied by T7 to L1 spinal nerves, and these are consecutive 7 dermatomes which are going to overlap with each other. Because of these overlapping dermatomes of the anterior abdominal wall, the particular area of the skin anesthetize when the dermatome above and dermatome below is also get anesthetized. And the knowledge of the position of the dermatomes helps in understanding the referred pain from some abdominal organs because of the possible communication between the somatic and the autonomic nerves through the corresponding segments of the spinal cord. So we can say that the appendix, that is also going to be supplied by the T10 spinal nerves. Along with them, testes and the ovaries, they are also having the same innervation from the T10 segment, and that's why any disease concerned with the vermiform appendix or the testis or ovary may lead to the referred pain around the umbilicus. So this is all about the nerves of the rectus sheath. Now, after completion of all the muscles of the anterior abdominal wall and the rectus sheath, we can say that this flat anterior abdominal wall muscles, they are digastric in nature because the aponeurotic fibers of both the sides muscles, they are going to intermingle with the linea alba, and this linea alba act as the central tendon for both the sided anterior abdominal wall muscles, and that's why these anterior abdominal wall muscles, they consider as the digastric muscle. So this is all about the rectus sheath. Thank you.